Hi, my name is Dr. Jen Anaker, and I'm the owner of Anaker Clinics of Chiropractic. Welcome back to our videos. Today we're going to talk about the ergonomics of a desk. This is a question that I get often from my patients, and this is a really important one. Obviously, we spend a lot of time, the average American spends a lot of time seated at their desk for a lot of hours and a lot of years. So this is going to be a really important one. Yes, for people that sit at a desk as far as a traditional maybe office setting, but also you can think about your kids as students and certainly take some of this home as well. Now the ergonomics, this fits into one of our three pillars, which is we always like to answer chiropractic questions, so it certainly fits under that. Wellness topics, we can think about the health of your body, how this would also fit under that. And certainly my last platform is to give you a little insight into some of the things that I do for my own healthcare. So as you can see today, we're sitting in front of our office desk, and I wanted to demonstrate a few tips for you. So the first one is, where should the monitor be? So the monitor, sometimes you'll say it should be like 1.5 feet out, but also it should be right at my eye length is the top of the monitor, so that positioning is great. I will say with monitors, I only have one monitor here, but sometimes as I'm talking to my patients that maybe have two monitors, I would say if you can also square up to one or the other by moving your chair and your body would be great, as opposed to creating that twisting motion can cause a lot of stress, especially on the neck and shoulders. So that can be something to think about if you have two monitors. Now the next thing is the positioning of the hands. And so from the shoulder, bending at the elbow here, we want a 90-degree angle, and we want the arm to be straight and the wrist to be straight as well. So certainly we want our keyboard to be able to be right straight out. We also want to watch the wrists. I know this is a conversation that I had with a patient the other day, where you don't want the wrist to be up or down or turned. Try to keep this wrist, I'll say, as a unit where you're not putting a lot of angle on the wrist, which is ideal. Also, with the chair itself, when you're sitting in the chair, you want to make sure that your feet, so as you're sitting in the chair, think about this being your thigh. We want to make sure that between the thigh and the lower leg that there's a 90-degree angle, and certainly we want to try to get our feet onto the ground. If you find that you're shorter, you can always buy, I'll just call it a box or something to put your feet on top of, but certainly you want to keep that 90-degree angle. Now personally, for great posture, I like to sit a little bit more at the edge of my seat. But let's be real, a lot of you guys are working 6 to 8 plus hours sitting at a computer, and so certainly that may not be your only position of choice. So also you can find, we sell this at our office, but you can find a lot of lumbar or low back supports that you can just put this in the back of the chair, and that'll help to make sure that your hips are in a good spot. So your hips themselves, you want to be able to get your body more upright, so rolling your hips forward a little bit brings the rest of your body up. This part right now is something that I could talk about at the computer, on your phone, on your iPad, is to really watch what gets people in trouble. Obviously, over a long period of time, you're spending a lot of time sitting here, is to watch this kind of posture here. Puts so much stress on that head, the neck and shoulders, and certainly also puts a lot of stress on that low back. So I always kind of teach the kids with posture, if you had a string, just pull yourself up, and that's the better posture to be in. But people will also, again, have to sit for a long period of time. It's great to get up every 20-25 minutes. Sometimes that's not a doable time slot to get up and move around. So also I just tell my patients, to create 4 movements in your body, whether it's shrugging your shoulders back, maybe moving your legs under the desk, moving your body side to side. We're meant to be hunters and gatherers and have movement in your body, and we lead very sedentary lifestyles. So definitely, take a look at your posture, look where you're at, keep your shoulders relaxed, keep some movement in your body, and then watch when you go back to work or go to your office and in your home, or watching your kids working on a computer at night, something like that. Look for these different points that I pointed out. Where's the monitor? Where's the, are the arms and the hips at 90 degrees? Is your arm straight out so there isn't any bending at the wrist, or that the lower arm is elevated higher or lower? There's lots of different tips that you'll find for the ergonomics, but certainly start with these. Take a look at, what you can improve, and I hope you found this helpful. I know a lot of us these days are on so much technology that certainly, I hope there's a piece that you could take for you and or your loved ones.